is Maddie. I'm going to be
Maddie.
your nurse today. I'm going to perform some hand hygiene here. So how are you doing today?
I don't feel too good. Like, I'm just having pain. Like,
I'm sorry about that.
here. Yeah.
So, first of all, can you tell me your name and date of birth, please?
Allison Cherwenko, 7/16/99.
Okay, awesome. And do you know why you're here today?
I think I have a UTI.
Okay, yes, that's perfect. And do you know where you are?
Yeah, Iowa City.
Okay,
The
awesome.
hospitals.
And what month is it?
May.
Okay, perfect. Sounds good. I'm going to do a complete head-to-toe assessment on you, and we're going to do some tests, and then after that, we're thinking about getting you some antibiotics to hopefully get that UTI under control. We're waiting on some labs for that. For right now, we're just going to do your assessment, okay?
Okay.
All right, so the first thing I'm going to do is your vitals. So I'm going to do your temperature. Do you have a preference for your temperature? Okay, awesome. Beep. Okay, sounds good. And then we're going to do your pulse here. I'm going to do your radial pulse. Turn around here. Okay, so it's regular. And then I'm going to do your blood pressure. Do you have a specific arm that you prefer?
The left.
Okay, and then I would not do this if she had dialysis fistula or a IV going on in that arm, just because that would not be compatible with an accurate blood pressure reading. So I'm going to pretend that I just took her blood pressure, and then we're going to go with that. Perfect. And then I'm going to count her respirations, just watching the chest rise. It looks like they're regular, looks great, non-labored, so that's good. And so, yeah, now I'm going to move on to just starting at the head. So the first thing I'm going to do is I have to do a little neurological exam. So can you stick out your tongue for me? And then smile, and then frown. Okay, great. And then can you feel this, both sides? Okay, awesome. And then I'm just going to do an inspection, just making sure everything looks good. And then I'm going to do the Perla exam. So I'm going to shine a light in her eyes and look for equal reactive response in both pupils. Okay, that looks awesome. Okay, and then we're going to do her lung assessment next. So I'm going to listen in 3 to 4 areas just throughout the chest in a lateral pattern. And I would do this skin to skin to make sure that there's actual you don't have to do it skin to skin, but on a real patient, I would do it skin to skin. Take a deep breath. Awesome. Another deep breath. Awesome. And again. And one more time. Awesome. So next, I'm going to do her cardiac assessment. So I'm going to listen to her heart in 4 areas, which will be the atrial, then the atrial, then the pulmonic, Erb's point, then I'll do the mitral valve. And we're going to start with her right side, and then we're going to go down to her left because the left 3 are on her left. Okay, so that's done with her chest. And then I'm going to move down to her abdomen area. So first I'm going to draw the curtain to provide privacy for her. And then I'm going to pull up her shirt just so that we can visualize this, making sure that the bottom half of her is covered. And first I'm just going to do some inspection, just making sure things look symmetrical as far as the umbilicus and any skin lesions or discoloration on her abdomen. And then next I'm going to auscultate because I don't want to palpate first because her abdomen could change if I palpate first. And I'm going to do it in a U-shaped pattern, starting with her right side and up towards her ribs and then back down. And again, this would be skin to skin, but right now we're not going to do that. All right, that sounds good. I heard some bowel sounds, which is great. And then I'm gonna do some light palpation, just feeling around for any significant protrusions or anything that I can feel just on the palpation. Do you have any pain?
Yeah.
In your stomach? When I do this? No?
No.
Okay, awesome. Okay, that looks good. And then I'm gonna move on to her arms, her extremities. The first thing I'm gonna do is look at her, her fingers, and I'm gonna look for signs of edema in her extremities. It looks like they look okay. Just upon inspection, there's no signs of hypoxia or anything in her fingers. Her capillary refill looks great. She does have fingernail polish on, so in this case I would just flip it over and I could do it on the her fingertips. And we're looking for capillary refill in less than a second. And then we're gonna do her radial pulses, make sure that they're prominent. Yep, that's awesome. And then do you have any numbness or tingling in either of your arms or your fingers, anything? No? Okay, awesome. Okay, and then I'll make sure I'm not forgetting anything. Okay, so those are both of her pulses. And then I'll move down to her her legs and her feet. I'm gonna, oh, one last thing, I forgot. So I'm gonna have you push me away with your hands. Awesome. And then pull back. Okay, that's great. You're strong. All right, and then we're gonna do the same thing here. So pull, awesome, and then push, good. All right, so I'm gonna just inspect her ankles, and I can always just kind of press on her calves to look for edema. If it's pitting, it would just stay there, and it looks like that's not present, which is great. And then I'm gonna feel her pulses, her dorsalis pedis, and the other one, which I can't remember, which is okay. Make sure they're present. And then on the top of her feet. Yes, that sounds great. Okay, and then I'm gonna do capillary refill on her toes as well. Just looking for refill. And I would do this bilaterally on both of her extremities. And then after I fold the pulse, I'm gonna ask her again if she has any numbness or tingling in your feet.
No.
Okay, awesome. And there's no signs of swelling or discoloration, so that's great too. And then I'm gonna ask her, are you in any pain today?
Yeah.
Okay, so on a scale of 1 or 0 to 10, 0 being no pain and then 10 being the very worst pain ever.
Think like a 7, especially when I go to the bathroom.
Okay, that's good to know. Can you describe the pain, the location, how it feels?
Yeah. My, like, down there area, like, it's hard.
Can you just point to it?
Yeah, like,
it's
just
all
like,
there? Okay,
it
awesome.
feels
I'm sure that's related to your UTI. Okay,
Yes.
that's good to know. Is it a burning, numbness, just like gnawing pain?
Definitely burning.
Burning.
Yeah.
Okay, that's good to know. And then I'll let the doctor know that you're experiencing that pain. We may be able to get you some pain medication. So that concludes my head to toe assessment of you today. Can I grab you anything else before I leave the room?
Yeah, water.
Okay, I'm gonna go get her some water. I got her some water, and I'm gonna grab the call light for her, and I'm gonna put it right next to her in the bed. So the call light is right here. You can just press it whenever you need me, okay? And then I'm gonna bring the bed to the lowest position for safety. And I'll be back in probably 10 or 15 minutes just to reevaluate, maybe get you some pain meds. And I'll communicate all this to the doctor, and we'll go from there, okay? Okay, thank you very much, and I'm going to open the curtain and perform hand hygiene again. All right, thank you very much, Allie.
Thank you.